Good afternoon, class. This is Mrs. T. I'm sorry I'm not in class today. I am currently sick. Yeah, I'm sickly. But anyway, I am still here to give you your lecture. So please make sure you listen and make sure you write everything that you need to. Okay? So this is the continuation of our lecture from Monday. We're going to finish the chapter on respiratory system today. Okay, so last Monday we started talking about the anatomy of your respiratory system, and we did talk about the four stages of what? What was that? Four stages or four events of respiration. So, let's talk about the mechanics of breathing or pulmonary ventilation. What happens when you breathe? Exactly. Right? So, breathing is a completely mechanical process. Okay? That means it's a mechanical process and you will be able to breathe depending on the volume changes in your thoracic cavity. Now, not only volume changes matter, pressure changes also matter. So what happens is you need to have flow of gases to make sure this pressure are equalized. Okay? So, let's see. You have two phases for breathing. Okay, first off, you have inspiration or inhalation. That means you allow air to go into your lungs. And then finally we have expiration. No, not the ones that are in food. Okay, but exhalation is actually also called expiration, and this is when you allow air to leave your lungs. Okay, so these two phases are very important in breathing. That means you cannot just survive with inhalation. You can't just keep inhaling air. You need to exhale it too. Okay? Alright, so inspiration. What happens during inspiration where you allow air to go into your lungs? During inspiration, what happens is your diaphragm and your intercostal muscles, they tend to contract. So the size of your thoracic cavity would increase. So here's what I want you to do. I want you to put your hands, okay, both of them, on your ribs. Okay, just by your ribs right there. And trying to inhale. What happens? Did you feel your ribs kind of go out? Okay? Did you feel it kind of move out towards the outside of your body? This is what happens because now your thoracic cavity is increasing because you're putting air inside. Okay, so external air is pulled into the lungs, and this is because of the increase in intrapulmonary volume, because now you're contracting your diaphragm, and at the same time, it's decreasing the gas pressure inside. Okay, so when this happens, you are inhaling. Okay, so here we go. So as you can see, when you inhale, okay, this side of your what do you call this? Your ribs, they would actually expand out. Okay, and the air would then come in towards your lungs. Okay, so that's what happens during inhalation or inspiration. Now expiration, okay, here we go. Expiration is also a natural process, and usually what happens is expiration would occur because of your lung elasticity. Okay, so as muscles relax, what happens is the air tends to be pushed out of the lungs. That means the air is getting out of your lungs. Okay, because now you're relaxing the muscles. As a result, it produces decreased intrapulmonary volume and increases the gas pressure inside the lungs. Okay, now when you force expire, that means you're forcing yourself to exhale. Okay, what happens is your internal intercostal muscles tend to contract during inhalation. It's the external intercostal muscles that contract. But during expiration, it's the internal intercostal muscles. And as a result, your rib cage would then tend to depress. So again, put your hands on your ribs and inhale and exhale, you will feel that your ribs will move in and out. Okay, that means it will move out when you're inhaling and will move in back when you exhale. Okay, so here we go. If you compare this picture to the one that I previously showed you, this should be less. Okay, the circumference should be less compared to the previous one. All right, so that's what happens during inhalation and exhalation. All right, so in your thoracic cavity, you normally have pressure differences. Okay, and this pressure differences is very important. Now, the pleural space, that means the space between your lung and the muscle outside of your lung, it will always have a negative pressure. Now, this difference between the lung and the neural pressure, okay, it allows your lungs from collapsing. So what happens is if the lung, okay, if this pleural space is accidentally punctured, say you have an accident, what happens is your lung tends to collapse because now you have no difference in pressure. Okay, that's why some people, one of their lungs gets collapsed because now the pressure difference is not present. Okay, all right. Now, let's talk about non-respiratory air movements. Okay, that means this is not natural. This can be voluntary action. Okay, so it can be a reflex or it can be a voluntary action. So an example would be coughing and sneezing. Sometimes when you sneeze, okay, sometimes there's a point where you're like, I cannot handle this anymore, I have to sneeze. The same thing with coughing. The reason why you sneeze and cough is because you're trying to get rid of any debris in your lungs. Okay, now for crying, okay, you allow air to go in and out of your lungs because now you are crying. Your emotions are affecting the way you're moving air in and out. Okay, so when you're crying hysterically, you tend to breathe in and out faster. When you laugh, okay, it's actually similar to crying because it's also emotionally induced. But sometimes you laugh that you cannot breathe anymore. All right, okay. Hiccups, I do not like them. Hiccups are sudden inspirations. Okay, so this is like a reflex. It's very hard to control a hiccup. Okay, yeah, I don't like them. And then you have yawn. Yawning is also a type of inspiration, but it's very deep. You don't have that yawn where like you open your mouth and you close it in 1 second. Usually it extends for a couple of seconds. Okay, so these are examples of non-respiratory air movements. Okay. All right, so what's next? Respiratory volumes and capacities. Now take note of this. I will ask you questions during the test, especially about the names of the volumes and the capacities and how much they have. Okay, so please take note of this. Normal breathing moves out about 500 milliliters of air with each breath. Okay, and Bella is here. Okay, sorry. Okay, let's see. This respiratory volume, that is the amount of air that you breathe in out, is what we call a tidal volume. We give it the sign TV. Okay, now the tidal volume can be affected by a person's size, sex, age, and physical condition. So that means a man has a different tidal volume than a woman. Okay. And physical condition, are you an athletic person? Are you somebody who likes to just sit all day long? Okay, as well as age. The younger you are, the better your tidal volume is. The older you get, the less tidal volume you get. Okay, all right. So that's the first respiratory volume I want you to remember. Tidal volume has about 500 milliliters of air. Next, inspiratory reserve volume, IRV. IRV is the amount of air that can be taken in forcibly over the tidal volume. So let's say you inhale normally. Okay, let's say, okay, try this. Inhale normally. and then try to inhale more and more and more and more and more until you cannot inhale anything anymore. That is what we call inspiratory reserve volume. This is usually about 3,100 milliliters. That means you can add more air to that 500 that you inhale. Okay? And of course, we have expiratory reserve volume. So, here's what I want you to do. Exhale normally and keep exhaling until you cannot exhale anymore. Okay, that means you're forcibly exhaling all of the air in your lungs. That's the expiratory reserve volume. Okay, now this is about 1,200 milliliters. That means the amount of air that you can forcibly exhale is less than the amount of air that you can forcibly inhale. Okay, so look at the numbers. You have 3,100 compared to 1,200 milliliters. Okay, so that is the inspiratory and expiratory reserve volume. Next, residual volume. Residual volume is the amount of air that is always left in your lungs. So let's say you exhale, keep exhaling. No matter what you do, you still have air left in your lungs. You cannot take that away. That will always be there unless your lung is collapsed. So that means you say, oh, you take my breath away. In reality, no girl or boy can do that because you have residual volume, which will always be there. Okay? All right, so that's residual volume. What else? Vital capacity. Vital capacity is the total amount of air you can exhale and inhale. Okay, not just normal inhalation or exhalation. This also includes the forcibly inhaled and forcibly exhaled air. To get the vital capacity, we use this formula. Okay? Tidal volume plus inspiratory and expiratory reserve volume. Okay, so again, that's the total amount of exchangeable air that can go in and out of your lungs. And then finally, we have we have another one. Okay, you have dead space volume. This is the air that remains only in the conducting zone. Okay, that means it doesn't reach the alveoli. It only stays within the bronchi and the bronchioles. Okay, and that's about 150 milliliters. Sorry, Bella is next to me and she is talking. Oops. Okay. All right. So that's about 150 milliliters. And then we have the functional volume. Okay, hold on. All right. You have the functional volume. The functional volume is the air that actually reaches the respiratory zone. Okay. This is about 350 milliliters. Now, if you want to know all about the volumes and the capacities, normally you measure these capacities and volumes using a spirometer. Unfortunately, we don't have one here, but when you go to college and you take anatomy and physiology, normally they would make you use that and you can actually measure the amount of air that your lungs have. Okay? So, those are the respiratory volumes and capacities of your lungs. All right? Now, let us start with the next part. Okay, let's start with the second part of your lecture. So, hold on.